Hey there, rock stars. It's Rachel. I just want to do a short recording here on some of the common pharmacology that we see commonly used that affects the exciting world of cellular regulation. First up is the medication category 5-alpha reductase inhibitors with the prototype medication of Finasteride. This medication is used for advanced prostate cancer and is used to inhibit testosterone from being converted into a form that can be absorbed by the body. The goal of this pharmacology is to shrink the prostate to starve it of testosterone, thus avoiding surgical castration, otherwise known as an orchiectomy. It should be noted that women of childbearing age should not handle this medication without gloves. It is a pregnancy category X. Absorbable testosterone is also responsible for male pattern baldness. Therefore, blocking that absorption can cause hair to grow back. This medication is sometimes prescribed for alopecia. It is widely reported that Donald Trump uses this medication for his long, luxurious locks. Unfortunately, blocking testosterone does not come without serious side effects. Blocking testosterone will cause a decrease in libido, it can cause erectile dysfunction, and is known to cause a depressed mood. Alpha-1 adrenergic blockers with the prototype medication tamsulosin don't actually cause cellular changes, but they do affect the prostate. Alpha blockers inhibit norepinephrine's effect on the prostate, which causes that smooth muscle to relax. We've studied alpha blockers in the past when we were looking at antihypertensive agents. Because alpha blockers do cause vasodilation, that's a side effect we want to watch for anybody who's on an alpha-adrenergic blocker. All right, we're going on to alkylating agents with the prototype medication cyclophosphamide. Now, way back in World War I, mustard gas was used as biological warfare. It should be noted that mustard gas is neither mustard nor a gas, but is an alkylating agent. Those exposed to the mustard gas were found to have bone marrow suppression. And after studying it, it turns out that the mustard gas damaged the DNA, especially of quick dividing cells, thus the beginning use of alkylating agents therapeutically. Cyclophosphamide works during the resting phase of cellular replication, thus making it a nonspecific agent. Patients who take this medication can reach their nadir about 14 days and can recover completely from this medication in about 21 days. Next up, estrogen receptor blockers with the prototype medication Tamoxifen. This medication binds to estrogen receptors on the tumor cell so that estrogen in the body cannot bind to them. This eventually causes the cell to starve and die if it feeds on estrogens. This medication can be used for a number of reasons. It can be used to shrink a primary tumor prior to surgery, for metastatic breast cancer to achieve a longer life, to prevent recurrence of cancer, or to shrink breast and ovarian tumors. Because tamoxifen blocks estrogen, it will have side effects that mimic menopause, including hot flashes. Gonadotropic releasing hormone agonists are our next category of medications with the prototype medication Lupralyte. Lupralyte decreases luteinizing hormone, and luteinizing hormone is necessary for the production of testosterone. Thus, with this med, testosterone is decreased. This medication is used in advanced prostate cancer to avoid surgical castration or an orchiectomy. It will slow the progression of cancer, but it will not stop it. It's a palliative treatment. It is not curative and has side effects of hot flashes, gynecomastia, impotence, and decreased libido. Anthracyclines are our next category of medications with the prototype drug doxorubicin. This is an anti-tumor antibiotic, and it interferes with the cell at any phase and damages its DNA. It also binds with the enzyme that is used to fix the DNA so that the cell cannot be healed. Side effects of this medication include severe bone marrow suppression. The nadir is usually 10 to 14 days after the dose. Another side effect is alopecia. You could see red urine, red tears, cardiac toxicity for years to come, hepatotoxicity, and this is a vesicant drug. Do not give it peripherally. The class of medications that communicate with the inflammatory system to help it to recognize cancer cells and viruses better to attack them are immunomodulators. And our prototype medication is interferon alpha 2B. Biologic response modifiers such as interferon alpha 2B, otherwise known as immunomodulators, change how the body reacts to cancers and some viruses. They may cause flu-like symptoms because of the immune response. The last medication family that we're going to go over is immunosuppressive with the prototype medication cyclosporine. Now, this medication inhibits our T cells, and our T cells are imperative for our immune system to work well. This medication is used to depress the immune system and is used after organ transplant to prevent rejection of the new organ. It is sometimes used with autoimmune diseases as well, and in an optic form to help chronic dry eye. Obviously, immunosuppression is going to be a major side effect. All right, rock stars, that's all I got. I hope this helps with your understanding of cellular regulation medications.